Hello, welcome to the CCM Recruitment International tutorial on the UK nursing registration process. This guide will focus on the application process required for nurses trained outside the European Union. In order to work in the UK, all nurses must be registered with the UK Nursing and Midwifery Council, known as the NMC. This process can take anywhere from 6 to 12 months for overseas applicants. There is, of course, fees involved, which many nurses find confronting. However, most hospitals, especially those that CCM work with, will cover majority of your registration costs, reimbursing you upon your arrival in the UK. Nurses also get anxious about the 3 exams involved in this process. CCM Recruitment will help you understand the process and prepare you with PDF information and study guides provided at each stage. We assure you that if you plan ahead, focus and study, your UK registration is totally achievable and worth the effort. Before we go on to look at each stage of this process, it is important to look at the eligibility for registration. Each nurse must have practiced for a minimum of 12 months, hold current registration without restriction in your current country, have successfully completed at least 10 years of schooling prior to your nursing education, and demonstrate a high standard of English language understanding. Due to the specialised registration categories in the UK of adult or general, children's, learning disabilities, mental health and midwifery, many overseas nurses are limited to apply for registration as an adult nurse only. Let us now look through the step-by-step process involved. All nurses must provide evidence of a high level of English understanding. It is your responsibility to book and complete an English language exam as the first step in your registration process. We recommend you book this early to get started. The International English Language Testing System, or IELTS, is the only accepted evidence of language competency for the NMC. This is an internationally recognised and conducted exam held under strict conditions. 2 formats of the exam are available, general and academic. All nurses trained outside the European Union are required to pass the academic IELTS as part of their application. This does include all Australian and New Zealand applicants, as there are no exceptions to the requirement, regardless of which country you are from or if English is your first language. IELTS test centres are available in many Australian and New Zealand cities and include facilities such as universities and British embassies. You can find your local test centre, register, book and pay online. Exam fees do vary slightly depending on the facility, but range from $330 to $350 Australian dollars. Exam places can fill quickly in certain test centres, so you may need to book in advance. Please also allow yourself adequate preparation time when considering your booking. The total test time is 2 hours and 45 minutes. The exam assesses your ability to listen to, read, write and speak English. The listening, reading and writing components of all exams are completed on the same day in one sitting with no breaks. The speaking component may be completed on a separate day and time depending on the facility. Results must be less than 2 years old when submitted, with a minimum score of 7 in each area. However, you can now submit 2 test results to achieve this score if you need. Facilities that offer exam bookings generally provide study material or offer courses to prepare you for the exam. CCM strongly recommend you complete some pre-reading and study guides to help you pass the exam. Once you have your IELTS results, you can complete the application forms available on the NMC website for processing. The online application is accessible via the NMC website. You must sign up making an account with your personal details included in an email for contact purposes. You must apply for the registration application of nurses trained outside the EU. Please remember to enter your IELTS ID and results number when asked. Following your online application submission, the NMC will notify you if you meet eligibility requirements to proceed to the next step, the test of competence. Part 1, or computer-based test, known as CBT, examines your theory-based knowledge from a pre-registration standard. All nurses trained outside the European Union are required to pass this exam to proceed. You will receive a notification via email and further details from Pearson VUE to book and complete the test. Pearson VUE will provide you with login details and dates specified for when you must complete the test. Test centres are available in most countries around the world, and you can book online or over the phone with a payment of £130 made at the time. The CBT is a multiple choice exam with 120 questions related to the 4 main nursing domains of professional values, communication and interpersonal skills, nursing practice and decision making, and leadership, management and teamwork. A maximum of 4 hours will be allocated for you to complete the exam. You must answer all questions in this time frame with no extensions granted. All questions are scored as correct or incorrect with an overall score of 60% required to pass. You will, however, need 90% of all critical questions answered correctly. Therefore, it is best to treat all questions as critical and leave none blank. The exam can seem daunting, as many of us get anxious about exams and the unknown. However, CCM assure you, if you understand the process and how to study, you will be as prepared as possible, hopefully reducing your anxiety and increasing your confidence to succeed. CCM can provide you with a study guide formulated in accordance with the NMC blueprint. This outlines the domains, competencies, and has links to skills and knowledge included in both tests of competence. Further recommended reading is also available to help you. We strongly encourage you to start studying before you book your exam. Please do not leave this to the last minute. Following your CBT results, the NMC will assess your application and supporting documents. The assessment phase takes between 70 and 90 days to complete. It is highly recommended that all documents and supporting evidence are completed, correctly filled in and submitted together with your initial application to avoid delays during this period. This is the time where you are also required to access relevant forms from third parties. Education, employment and registration forms must be completed by the relevant department and directly returned to NMC. Some facilities do charge a fee to complete these forms and will require you to provide stamped returned envelopes. Please confirm these details with the facility when you inquire, again to avoid delays. Following assessment of your application and supporting documents, the NMC will notify you of the need to complete Part 2 of the Test of Competence. This test is only available in England, so this is when your travel arrangements, visas, flights and accommodation must be organised. For nurses with already approved contracts in the UK through CCM, these details will be further discussed and arrangements made for you. Part 2 of the Test of Competence is the Objective Structured Clinical Examination, or Oskie. This practical exam is designed to assess your ability to competently apply your professional skills and knowledge in simulated clinical environments with common patient scenarios. You are assessed at the level expected of a new nurse during the exam. You can only sit the Oskie once you've received information from the NMC directing you to book the test. The University of Northampton is the only facility to conduct this exam and must be done in England. The test does have a fee of £992 associated, but please do not allow this figure to alarm you, because remember, nurses that have UK contracts through CCM will receive financial assistance and support from the hospitals at this stage. For example, the hospital will offer you time before the exam to prepare, offering mock scenarios and practice sessions with other nurses. Resources and reading material will also be provided when you book your exam. The exam is made up of 6 stations. 4 stations will be scenario-based and relate to the holistic, patient-centered assessment, planning, implementation, and evaluation stages of your nursing care, and 2 stages will be testing your practical skills. Each station assessment lasts 15 minutes plus preparation time where instructions are provided. While the assessment takes approximately 5 hours, you will be at the venue all day for registration, NMC identification checks, and breaks. A panel of examiners will measure your ability to complete the task within the set time frame using a standardized marking criteria. All of the scenarios and questions will relate to your current best practice rather than local hospital policies, and will include assessment of your skills, communication, and practical ability. A final identification check will be conducted by the NMC on the day of your Oskie. The NMC will direct you when to make this appointment and what to bring for the final decision on your registration to be made. At the interview, the NMC representatives will make final checks on your previous registrations, take a photograph of you for their records, and check all original documents. Following the successful Oskie result, you will receive a final decision letter directing you to pay the registration fee of £153 in order to issue your PIN or registration number. Processing time of this may be a few weeks, with many hospitals allowing you to work as a paid healthcare assistant while you wait. Once you receive your PIN, you can continue working as a registered nurse in the UK. And that sums up the UK nursing registration process for an overseas applicant trained outside the EU. As previously mentioned, CCM will guide and support you through this process, offering assistance at each stage. Our study guides, formulated in accordance with the NMC blueprints, will help you understand the domains and competencies tested. And PDF versions of this information are also available upon your request. Do remember that the hospitals that we work with will also support you to gain your registration, providing financial support and education. We hope you found this tutorial useful. If you have any further questions, please contact your CCM recruitment consultant for further information. We look forward to hearing from you soon to kickstart your nursing career in the UK. Thank you for watching.